Hello. Today, the Dartmouth Wanderers, who are associated with the Council on Aging and DCTV, bring you another segment of Town Talk. And it's very appropriate today that we call it Town Talk because that's what we're going to discuss. We're going to discuss our town of Dartmouth and another way in which we hope is a method of improving it, especially for elderly citizens. I have as guest today Andrew Pollock, who is the Executive Director, newly appointed Executive Director of the program. And see, incidentally, you're going to hear me say CNN. It's not the CNN, but it's the Coastal Neighbors Network is the name of this organization, and it's quite widespread and growing rapidly. And then we have Kate Fentress and Dr. Steve Keishel, who are board members. There are 9 board members overseeing this particular program, and we're going to have them discuss many of the aspects of it today, how and why it was formed, what niche they're trying to meet, and some of their goals. I'll start by asking Andy, why don't you give us a rundown of where we stand at the moment? You are really newly appointed, aren't you?
I am newly appointed. I am freshly minted. Yes, this is true.
Okay.
But I'm a Dartmouth guy. My family's from Dartmouth. I've been on the board for a year and have been active and really excited about CNN and what we have to offer the town. A little bit about the history of the village movement. This isn't an abstract concept. It was started 15 years ago in Beacon Hill in Boston with a group of people that got together and discussed how they could age in place. And what we like to say now is age in community. So over that time, people kept contacting them to start villages in other parts of the country. Today, there are over 40,000 people involved in the village movement in the United States and a few other countries. There are over 200 villages that have formed, 17 in Massachusetts, and there are about 150 villages that are in formation. They're becoming villages, and ours has just moved from, hooray, hooray, from a formation to an actual village. We are running a soft opening with a few members this summer, and we are actually providing service, and we have members, we have volunteers, and we're up and running. A year ago, we met with you, and we were not in that position, so we've moved quite a long way over the past year.
I'm sure it wasn't even a year. You've made a great progress.
We're doing good strides.
Last few months, and it looks like we're going to be seeing something here in the town of Dartmouth shortly. I know that initially we discussed Gate and where it started. It started in Boston, as I understand.
Beacon Hill Village just celebrated its 15th anniversary, so that was the beginning. That was an urban village, virtual village, one that doesn't exist in a place but is virtual. Members stay in their homes and use the village for different supports to help them stay safe and stay connected to the community. Most people, when they get older, don't want to leave their homes. They want to stay in their community, in their home, where they feel comfortable. And the village movement has grown out of that group of people realizing we can do something about that. We can stay at home, we can stay connected, and we can create a community of safety and support to do that. And it's much less expensive and much more fun than having to pay people to provide services to enable us to be at home.
Now, Joe, the interesting thing is that this is the builder generation and the boomer generation, and they're the ones who have seen what has happened to some of the older population, and they're not having it. So they're looking at ways of creating a community that works for them and works for us. And 50 years ago, people didn't live as long. They had other social constructs that kept them safe and connected, churches or religious organizations, ethnic organizations. Kids lived at home or closer to home, and there were a lot more safety nets available for people in town or just in the United States. As we become a more secular nation, as children have dispersed across country, people have found themselves alone in some cases as a spouse passes, or somewhat isolated as transportation options decline. You might not drive at night. There might be some difficulties with weather. There might be some isolation as friends pass on or move away. And the village is looking at ways of filling that gap. We don't want to duplicate some of the services that are already going on in town. In fact, we want to complement those services. We want to help people connect into the fabric of the community, both volunteers who are younger and members who are a little bit older.
Right. You mentioned volunteers.
Yes.
Big part of this. So,
It's a big
why
part
don't
of
you
it.
give us an example of how they're used in other communities?
Well, we like to say become a neighbor. And sometimes people are looking for opportunities to volunteer an hour or two or maybe 4 a day or during the month. And they're looking for ways of connecting within their community to help people that need a basic helping hand. What we ask people to do is fill out an application. All the volunteers are Cori checked, and we interview them, make sure that they're appropriate and they know what they're getting into. And then what interests they have, maybe just a friendly visit. Someone might say, or changing a light bulb, or helping someone clean out a refrigerator. We say something that a friendly neighbor would do. You might not scrub the bathroom, but you would help change the battery in the smoke detector. So it's as simple as, and some people might say, well, I don't really feel comfortable being up on a ladder, but they may be comfortable having a friendly visit with someone who just needs an ear to talk with. And I think we were talking about earlier, there's a richness in the community that is not tapped. There's living history, there's fascinating stories that are out there, but we don't hear them as much because our culture does not value seniors the way other cultures value seniors. So when someone steps into someone's world and they hear stories about World War II, I think we were chatting about that. I was taking care of a fellow who was on a PT boat in World War II, and it was just fascinating hearing the living history about his experiences in the war and seeing the gunshot wound that he had gotten by German bullets, and just that was amazing to me. And it was a richness that he gave to me. And some people think, well, I've told the story 1,000 times. Well, you can still tell it 1,001 times to a friendly volunteer.
I think that it's a great idea. I really do.
Joe, the other thing that we know is a big issue in Dartmouth for older people is transportation.
Yes.
We don't have public transportation in this community, and actually it's one of the issues. You know, they say that each village is different, but across the country, every village has to provide some transportation for their members because it's the one thing that all the villages actually do share. So we are setting up and training our volunteers to learn how to help people who are older in and out of a car. And to be able to provide rides to a medical appointment or to a hairdressing appointment or to go grocery shopping and help them with the grocery shopping. So that's something that we hope that we'll get some great volunteers to help us with.
I know that in other organizations, I know the Council on Aging, for one, they do get volunteers when,
Sure.
you know, and being a new organization, they're going to have to tap into the same group. But there's a lot of people out there that are willing to do it, and it's, as much as they're helping, it's a great feeling to feel you're needed. It's it's a two-way street. It's not just
Absolutely.
It's not just the volunteers. They're going to gain as much, if not more, out of it than the people they're transporting.
You're right.
In many cases.
And we're finding that Dartmouth's population is aging, as the 2010 census says that there are 11,000 people over the age of between 50 and 85 in Dartmouth, and that number is just increasing. So there's more, we have these obstacles, there's a growing demand, and we see an opportunity to step in and help.
I know. You were discussing that population situation, and there's no doubt about it. It's an aging population. Whether you reading the scare stories from the Social Security Administration that they're going to be, it's just catching up with them and all sorts of things, whether it's on a national level. There's no doubt about it. Overall, and individual villages are growing older a little bit faster than they did in the past.
So we're aging.
It's all, and it's good.
There
It's
are actually
good.
10,000 people turning 65 every day until 2029 in this country. So that's what's going on.
That's a lot.
It's a lot.
and we're going to be prepared to handle them. And I know the program you're working on is just it's great. And let me ask you a few questions. One, there's no limitations to where you can go, or is there?
As far as transportation, or as far as
yeah,
as services,
getting volunteers.
getting volunteers. We are starting with a small group of people, and we're looking at services provided for them. The best example is we had our first service. We brought someone to the doctor. She had a great experience. We celebrated it at a local restaurant, which was wonderful, and they went off to bring her home. And what an experience compared to taking an Uber ride to an impersonal ride to a doctor's office and then going home. It was a very social and a wonderful event. Some people are signing up that may have issues around like a hip replacement or something that's coming down the pike and they may need some services. We are looking at each case individually. We're interviewing each member coming in and looking at their needs and seeing what is appropriate for services provided.
It's good. It just sounds like it has so many ups and very few downs. So people have got to know about it.
True. We do have different types of membership. We have a social membership, which allows people to participate in the social events that we have. We'd like to have social events that are special and unique, and we've set some of those up for the summer and for the fall, but we'd like to have some organic work within the organization. So if people are interested in something like the opera or a baseball game, or maybe one partner is at the opera and one partner is at the baseball game, who knows? But that would be something that would rise up from the organization itself. People saying, I'm interested in this, and I bet there's other people in town that are interested in this. So as Kate so wisely puts it, at a time where a lot of people's lives are feeling a little bit more claustrophobic as people are moving away or they're passing away, we're offering a time to blossom, to meet new people, to do new social events, and to experience the town in a fuller way.
It's good. And you know how it's worked in other villages, so it must, if you look at 10 villages, all of them must have one aspect of helping people that the other doesn't, because
True,
they come up with their particular village.
It's true. The state had a wonderful conference about the Massachusetts villages, and they're very interested because it's a great way of keeping people at home. People at home have a better quality of life. It's less expensive than to go to a assisted living facility, and that's where we want to be.
And the assisted villages, the homes in that area are they're filling up fast. You can tell by how fast they're expanding, putting new buildings up for the elderly. But but people aren't quite looking for that. There's a group out there that they want to stay at home, and I think that's always could be a key thing here.
You think about a neighborhood, and if you take all the old people out of the neighborhood, it loses something in quality. Whereas if people stay involved and stay integrated, which is what we can help them do, it just makes for a richer experience for everybody, the young people as well as the old people.
Exactly.
And so we really value that, and we want to promote that we can, just because we're older doesn't mean we can't still be involved and don't have things to share with others.
Yeah, we're finding that out as we interview people that are elderly, and they're some are so fascinating. I used to enjoy a couple of World War II people.
Oh, sure.
They started telling me how they were floating around in the Pacific after the ship got shot out under them, and there were only so many survivors, and you look and you say, this man doesn't look like he could possibly swim, you know what I mean? And because they're elderly, and the young people have got to be shown that. It's got to be explained to them, and I think this will be part of what you're trying to do.
Maybe one of our first activities will be training some of our members to make a show about that here.
It would be something, wouldn't it? Yeah, I'm sure they're going to have a lot of stories to tell. So there's no limit to how far you can go in terms of area or capacity. At this point, you're just going to try to handle. For example, what are the largest villages you know of?
Well, we're looking just at Dartmouth itself for the
Okay.
geographical area. There's a group in Falmouth now, a village there. There's a large village in Nauset, which is about 300 members. That's a 5-town radius. And we'd like to see, we named ourselves Coastal Neighbors Network because we don't want to be just Dartmouth. Eventually, we may look at as this expands, there may be other organizations like a Westport Village or a New Bedford Village or a Acushnet Village that may expand. But right for now, we're going to stick to our knitting and stick to our purpose in Dartmouth. Stay local and do it well and to do it right and to focus right here in town.
That's good, because we have an awful lot of, speaking of towns, we have a lot of smaller towns around here,
Sure.
not just the city, New Bedford,
Right.
where we're usually associated with. No, that's good. Are there any other things that you'd really like to point out?
Well, we are working medically. We have I think we mentioned earlier when we met with you before.
Yes.
That we have a health panel that will be looking to bring in some common sense to common problems. Basically, we have physical therapists, we have some medical administration people, we have physicians, and basically helping people understand their insurances if they have problems, how to approach this problem or that problem. We're not providing a medical service. No. We're just trying to help people figure out which direction to go and maybe help them, guide them, and give them the feeling that they have the right to ask the physician more questions if they don't understand their problems. On top of that, we've started working with the UMass Dartmouth School of Nursing, and where we've applied for one grant. We did not get it, but it was part of the conversation we've had. And they are actually looking at a cooperative situation with our group to use our older members basically as a teaching group for the baccalaureate degree nurses. And this would be monitored by their graduate program. And so we would be setting up relationships within the group that can go lots of different ways for different projects that are being discussed. Mm-hmm. So it's at an embryonic time, but it's a real, it's a potential fertile area that both sides can help each other. The younger nurses can be learning how to talk with older people. We get, as the older people, we get the companionship. They teach us things. It goes back and forth, but it's a different. It is a different venue, and I think something which can develop as we progress.
It's a nice idea to bring the generations, even if you skip one or two in between, get those young people in school. Absolutely. In volunteerism and everything. On a personal note, about an hour and a half ago, I went through something else that happens a lot, and that's prescriptions. The problems people have. And it's not their fault, but they're constantly changing prescriptions now. They change the name, they change how they're sent to you. In my particular case, I said, I'm not receiving them. Why not? Oh, we notified you. How did you notify me? I notified you by email. I said, I canceled that out previously. Are you there right now? Do you see that? Yeah, I said, can you cancel it out? Because sometimes you're talking with people, I don't know what it is, but prescriptions are important. And if you run out, it can be catastrophic for some people. And And I know it's strange, you know, because we have so many methods of communication. We have cell phones, we have home phones, we have emails, and God knows what else. I mean, but sometimes you get mixed up, and it can be very tragic. And I'm glad that the young people are being brought into it, and maybe they could be explained to also how important it is for elderly people to get those 18-letter words mixed up, you know, and not know what they're actually getting. So I do hope that continues. It looks like you're getting into a lot of ideas of bringing the different generations together too. It's not just one thing, because the people that volunteer here can be any age. And is there an age limit coming into this? Because
We're accepting people to be members from age 50 and up.
Oh, 50, okay,
Yeah.
50 and up, okay.
And the other thing that I think, you know, you said it earlier, Joe, about just people having purpose. And if you're on your own, sometimes you won't take the initiative to go do something. But if you have a group to do with, you could go and do a volunteer project, maybe work at Share the Harvest for an hour or so with a bunch of friends, do some harvesting vegetables, and then go and have coffee together. So we want to set up those kinds of opportunities for people that might not go out and volunteer because they feel uncomfortable. They don't want to do it on their own.
Right.
So we want to create that support network for our members so that they can become more active if they want to.
You know, we're so fortunate to have a university so close. The lectures that are there are so excellent, but I'm sitting at home and saying, only me, how am I going to get there? Who am I going to sit with? And so many other questions. Do I have to climb a lot of stairs? Whatever it may be. And so you can, if I know that's all available to me through a person that could come to my house and talk to me, it would make it much easier. We have so many things like our universities and colleges that are available to us. We got to take advantage of it. And I think of how many people are sitting at home tonight not taking advantage of some of the things that are being given at these places. So your idea is very, very good. And I understand that you're working with a new software system that's been used in many other villages, and it's really, you know, allowed everything to expand.
Yes, it was designed specifically for villages by a young man whose mother had joined a village, and he got interested in it that way. And he's at University of California at Berkeley, and so he designed a software that tracks. It has a very friendly user interface. It's large type and clear, and you can request a service on this software. You can look at our calendar of events and say that you're interested in attending one of the events. You can communicate about other kinds of things. So it's pretty comprehensive, and for our members who are computer savvy, it'll be a wonderful tool for connecting. And one of the things that we hope to do, if we do have members who don't use the computer at some point, is to help them learn some simple computer tasks so they can connect with us and also connect to the world in an easier way, and family members.
And if they ask for help, they'll be amazed at how much is available and how fast they can still learn it. Do you have limitations in terms of people that are handicapped?
That is a good point. There is, we will find transportation. The Council on Aging has transportation for people in wheelchair. We are not wheelchair accessible for transportation.
But you can find transportation.
We can find transportation
if they
for people.
need it. It's good, because so many of them need some help.
Right.
And it may be as
True.
much as a wheelchair, or maybe even more. I'm glad you're prepared to face that. I know I had so many questions here. I keep
We
you
have a
here
few
all night.
events coming up, or keep going.
No, go ahead. Go ahead, Ren.
We have two events coming up in the near future. One is on July 27th, which will be at Smith Mills Congregational Church from 7 to 9. It's an informational meeting for members and volunteers, people who are interested in finding out more of the village. We'll have information and just a time for questions and answers. We also have on September 25th event that's open to the public. It will be at the Commons at Friends Academy, and it's a physician. He's going to be speaking live for the Beacon Hill Village, and it'll be live streamed. So we'll be watching it live in the Friends Academy auditorium. His name is Atul Gawande, amazing author. He wrote a book called Being Mortal, just a fascinating book about, and he's written other things as well, but a fascinating book about the aging process in the United States. We had offered it in the winter. There was a there was a snowstorm. It got canceled and rescheduled. We had 80 people sign up within 24 hours for this fellow. So sign up early. And that will be through our website as well, or a phone call to me. But that's going to be a fascinating event that people can attend.
We'll have him. We'll have the presentation, and then we're going to have a facilitated conversation afterwards about his talk, because he's going to speak about the process of aging and how we can change it and give all of us, as we get older, more control over our lives. That's what he's all about.
I see. That's good. And that's what it's about. That's what the whole village concept is. You mentioned finances. We talked a little bit. You've already had a fundraising?
We have had very generous contributions from Dartmouth residents, and we are about 90% of what our fundraising goals had been. There are fees for joining. There's a fee for social membership, a fee for service membership, and a fee for a household membership. It breaks down to, the household membership breaks down to $1.47, am I correct, Kate? Yeah. A day, which when you consider the services and the social opportunities, it really is not a lot of money. The social membership is about $350 for the year. Uh-huh. So, and the membership.
There's no initial.
There's no initial fee.
That is the initial fee,
right.
And it's for a year.
Correct. Okay. So that is going to be the way the organization is funded, is through fees and some contributions.
Uh-huh. And as you mentioned, it is a nonprofit organization.
Nonprofit.
Have you applied for many grants?
We have applied for grants. One we did not get. Some are still out. Some organizations, Bay Coast Bank is one that's been very generous in their looking at our application. We're looking as well as to find some scholarship money for people who may be in need. So,
that'd be good. Okay, that's all good. I know you mentioned the fundraising, how you did it, and I know a lot of people didn't even know there was a fundraising going on. And I'm sure that when you come up with some other ideas, if that's what's necessary to help this, then incidentally, is that the average price of people joining these villages throughout the state and country?
We're roughly? Right about, each village is different, and some villages run differently, but we're about right in the average of what villages charge
to do this.
To do this.
Yeah, of course, you have to go through it a while to make sure to know how your particular village is going to work. You know.
One of the things that we know from the research that's been done about the network is that the membership dues don't fully cover the costs of running a village, which is one of the reasons why we raised money over the preceding year, so we'd have a cushion. Right. And we're trying to think both in our own village, but I think the movement in general is trying to figure out some ways to address that. Mm-hmm. And whether it's partnerships with hospitals and other organizations that want older people to stay healthier and to stay out of the hospital, so we'll possibly kick in some money towards supporting the village. But I think the whole movement is really looking at how to make it more self-sufficient and sustainable.
Yeah, so very interestingly, one hospital in Massachusetts provides membership to some of the people that are being discharged from the hospital for a temporary point of time, so that they can be involved in the village as they're recovering at home. So isn't that a wonderful idea?
It's great that they're doing it, and I can see more of them happening too.
And it's really reduced rehospitalization, which is why it works for the hospital
As
and it's
well
great
as-
for the village.
And it's great for that person, whoever gets the benefits from it, you know. I see that as a real good source of funding in the future. Well, so what do you see now for your short-term agenda?
Well, we hope to be back in a year, maybe even sooner, with a full running village up and running, up and going. So we're very excited with the summer with a small group, and then in the fall we'll be open for more members coming in. We're always taking applications, talking with people. If people are interested in finding out more information, they can go to our website, which you'll be listing, or they can contact me or any one of the board members. I'll be glad to sit down, have a cup of coffee with folks, and sit down and chat with them about the village, how they may fit, how the village may work with them. One other point that we'd like to say is that the village isn't going to be just for people who are to a point and then they're dropped off the table. We'd like to work, when someone joins the village, we'd like to continue working with them, even if they become frail and there may be other services that are needed. So working with them all the way through to say, perhaps at this point we need to look at some other additional options. And that's working with the person and helping them to make some good decisions around that. So as people become frailer as they age, we want to be there to help.
Good. And I imagine a big thing to be concerned with is people who have lost their memory problems.
Exactly.
And when you have a person like that, they usually can't be left alone.
True.
And they're going to need help. Do you feel that you'll be able to assist them even though they have memory problems?
We have
Provide services that might, I don't know, I'm asking.
Good question.
It's a great question. I think training as volunteers are being trained would be more on Alzheimer's care, and that would be a wonderful specialty that some of the volunteers may develop over time, is to work with Alzheimer's patients or people who have memory or dementia issues, because there's specific care guidelines or even communication guidelines that would work, that work well, and we can train people to do that. So that would be something down the line that we'd like
I'm
to
sure
see.
that's something
So-
that many of the villages are working on
Oh, I'm sure.
themselves and
I'm sure.
might be able to help you.
Absolutely.
And we also have to recognize that we're not professionals. And so if someone has major memory issues and behavior issues because of the dementia, we have to acknowledge that we can't be the main support for that person, that we could
Right.
we could provide some companionship, we could do a home visit, we could do some things, but that professionals need to be monitoring and making sure that everything's okay with that person.
Yeah, because it becomes a problem, and as you say, there's more elderly people turning every day, 10,000
Right.
people a day. We're going to see a lot more problems because we're so damn good at our medicine to keeping people alive a lot longer, and
Yeah.
so
It's true.
these problems will exist. I mean, there's no question about it. Well, can you think of any other things that you'd like to, that I missed, that you'd like to bring out, that you plan to offer? Or
Well, I think the village will evolve according to who our members are. And the people who join a village are the ones that, to a great extent, decide, well, what's really important to us? What do we really want to build into our lives that's missing? So I would invite anyone who's considering this as a possibility in their lives to come to the Smith Mills Church on July 27th at 7 and learn more about us and see whether or not it's something they'd like to do. It's not for everybody.
no?
But I think that it's obviously a movement that's grown across the country in the last 15 years, and we want to be part of it. We want to offer it to those who need it and want it.
Well, it's good. You brought a point out before that I want to emphasize. As this generations are getting older and more educated, they're traveling and living in different places. And whereas more children lived around their parents and they used to take care of them, and they couldn't all do it, but some could. And that's that's disintegrating slowly because the people are going all over. And you just look at where children are living when their parents died in the obituaries, and you might say, oh my God, nobody's around to take care of that person. If they needed help, we don't know. This is one more alternative for that person, and it's a chance for children who have moved away to feel very comfortable about knowing that their parents are still living a decent life, and as much as even if they were home. And you know,
Exactly.
people like that, it's important for it to be, maybe even contact these people, of the people that are interested, because sometimes they might think it's a financial burden or something, and it isn't. The child would happily help them. They've usually gone away because of what the parents did for them, so I'm sure they want to help, but if they're not there, it doesn't happen. So I think it's a wonderful service you're trying to provide, and wish you all the success. And I do hope you keep in touch with us on your progress. We'll be happy to show it on DCTV, and we'd be happy to put any phone numbers,
Wonderful.
emails for those that can use it.
Terrific.
And
We appreciate it
okay,
tremendously.
you.
and,
Thank you so much.
it's a
Thanks, Joe.
good project. Thank you all.
Thank you.